Hello, and thank you for joining us today at IFFGD's 2021 Virtual Advocacy event. Today, we're focusing on advocacy, ensuring that advocates have all the tools and answers they need to successfully contact Congress. And with us today is IFFGD's President, Ceciel Rooker, to discuss more about IFFGD's legislative priorities.
Thank you for having me here today, Marissa. I really appreciate this opportunity to be able to share these important issues with the patient population.
And can you begin by telling us the main areas of IFFGD's legislative priority focus?
Absolutely. So IFFGD has a pretty broad advocacy and legislative agenda. However, we do try to hone in on a couple very specific points. One is patient access to treatment, which is very important for those of us that are struggling with our diseases. Also, medical research in the area of gastrointestinal illness. That's also extremely important to us. And of course, raising awareness about GI disorders with the public as well as in legislative offices.
Wonderful. That's so great to let people know what a broad reach that our legislative priorities have for the GI community. And can you begin going into more detail about them by discussing some of these key medical research priorities, beginning with the NIH?
Absolutely. So the National Institutes of Health, as you know, is an institute that was developed by our government here in the U.S. in order to broaden education and understanding through research. It has many, many institutes, and there are a few that specifically deal with gastrointestinal disorders, and then there's some that just sort of orthogonally assist with patients with GI disorders. So as a whole, we are advocating that the National Institutes of Health get a $46.1 billion in funding for fiscal year 2022. That would be a $3.2 billion increase over 2021, the current year that we're in. But this would allow us to strengthen our biomedical research through the NIH in order to sustain some new innovations, have some groundbreaking new research opportunities. And in the wake of this pandemic, maybe allow us to learn a little bit more about how the COVID is going to affect people, especially with gastrointestinal illnesses or those who didn't before but now do. And so we are really hoping that Congress and the president will support us in this $3.2 billion increase for the National Institutes of Health as a whole. We also very specifically ask for an increase proportional to the National Institute of Diabetes and Digestive and Kidney Diseases. This is called the NIDDK. The NIDDK holds the largest portfolio of gastrointestinal research at the NIH. And therefore, as we ask Congress to increase funding for NIH as a whole, we are asking them to proportionally increase for NIDDK as well, because NIDDK does support basic clinical translational research for those of us suffering with gastrointestinal disorders.
Thank you so much. And can you also tell viewers a little bit more about our legislative priorities that are relevant to the Department of Defense and Department of Veterans Affairs?
Absolutely. So the military is really important to our country. And what so many people don't understand is that approximately 25 to 32% of all Gulf War veterans continue to experience symptoms associated with deployment. Many of these symptoms are related to their GI tract. So many have GERD, irritable bowel syndrome, some nausea and vomiting, a lot of pain, different types of disorders. And those are things that we're trying to understand. We're trying to understand how it is that these veterans come back from deployment with an unexplained illness. Sometimes people call this Gulf War illness. Some people call it medically explained illnesses of the Gulf War. Either way, there are portfolios of research in both the DoD, the Department of Defense, and the VA, the Department of Veterans Affairs, that are seeking to get a better understanding of what is causing these disorders and also how to treat them. And so therefore, in the wake of all that we've got going on in this country, I really feel that it is important that we do advocate to Congress to continue to support these research programs, and not only continue to support these research programs, but increase them as they can so that we can have more funding behind some very, very important topics for our military service members. And this actually goes for not just veterans, but people that are in service today. Research is showing us that not just deployed veterans are coming back with GI illnesses that are unexplained, but also people that serve right here in our nation. And how can we figure out how to make them better without research? And so we really do advocate, and we plead with Congress to please increase these research portfolios and ensure that our military service members are able to get better when they have finished their service to our country. We will have a program later this week that really focuses on VA and DoD and some of the research that they're doing, and specifically about functional GI disorders and the military service member. I personally have interviewed Mark Riddle for another segment during this advocacy event, and it'll be coming later on in the week. Please tune in for that. And if you miss any of our programs, of course, we have all our online resources at home. But there are many things that you can learn about what the VA is doing, their research portfolios, and then also what can you as a patient do to try to find help if you're suffering from one of these disorders.
Absolutely. Thank you so much. And of course, in addition to looking forward to the programs later this week that will touch on the VA, DoD, and resources and research, those that are impacted by Gulf War illness or other medically unexplained illnesses of veterans and military service members, or anyone who would like to learn more, can also take a look at our fact sheet number 440 on functional GI disorders in the military service member that is available in IFFGD's publication library.
Very true, very true.
And can you next touch on some of the key patient access to treatment discussion points that advocates can discuss with their congressional offices, and even just learn that are IFFGD's key priorities?
Absolutely. So patient access to treatment has been a very cornerstone of IFFGD's advocacy for many, many years. And as we are in our 30th year as an organization, we continue to raise that flag on behalf of patients everywhere. Patient access to treatment is a really broad category, Marissa. And so there are several different buckets in which this can fall into. And there are many, many ways that people are affected by different policies and procedures that make them not be able to get the diagnostic testing they need or the treatment options that they need. And so what we are trying to do is to really hone in on some of these key legislative priorities, especially those that are already have legislation built around them that have momentum in the congressional offices. And we try to join with that momentum in order to try to help move the needle forward. And so some of these, just to give you just really brief top line examples, are things like non-medical switching. So non-medical switching happens when you as a patient are working with your physician or your healthcare provider, and you've decided a treatment plan for you, and it's working and things are going well. And then your insurance company comes back and says, actually, we want you to be on a different medication. Now, this new medication may have an endpoint, as they call it in pharmaceuticals. Endpoint means this is what it's designed to treat. So it may just be designed to treat the exact same thing. For example, I suffer from a very slow GI motility tract, dysmotility in my GI system, and therefore I suffer from constipation quite often. Not very long ago, I was on one drug and it was working for me. And as you know, as in leadership of IFFGD, I did a lot of traveling, and with travel often comes more constipation. But I was okay because this medicine really, really helped me. And then I was asked to switch to a different medication, one that did not work well for me. And so therefore it disrupted my life. It caused me to have to go backwards in my treatment plan excuse me, my treatment plan in order to try to have relief from my symptoms. This sort of switching happens with no consultation with the physician or the patient themselves and can cause a lot of harm for patients that are finally getting their lives back and able to progress despite their chronic illness. So that is one. Another one with that is very similar is when you have step therapy. So step therapy is when an insurance company tells a patient, your doctor says that you should have a certain drug, like this is what you should be taking. But the pharmaceutical company, or actually pharmacy benefit manager who controls this program, comes through and says, in order to get to that drug, we want to make sure that nothing else works for you, none of the cheaper options. And so therefore, you as a patient might be required to do some of the over-the-counter medications that you've already tried, because so many of us suffer for so long before we even pick up the phone and call our doctor. And then we call our doctor, and our doctor starts us with a lot of these simple, maybe dietary changes, maybe an over-the-counter medication, and we try those and they don't work. And then finally, you get to the prescription medications and some stronger prescription medications, or maybe if you have something like Crohn's or colitis, they may put you on what's called a biologic to help to control your disease. With step therapy, they say, well, yes, the biologic is what your physician has asked you to take and thinks through his medical knowledge and his expertise that is what you need. But before we're going to allow you to do that, we want you to try these other treatments first. Now, what this does is it slows down your progress. In some cases, with some patients, it could be life-threatening, and it could cause more damage to the body while you're trying to go through these steps that have been put in your way. Step therapy is an issue that has been on the table in Congress for many years, and there is a bill. It is the a Step Therapy Act that has been introduced into Congress in this congressional session. As a matter of fact, it was just introduced in February. And so IFFGD is very much advocating that Congress pass this piece of legislation. This legislation would allow patients and their providers to be able to appeal a step therapy process imposed by their insurance in a very quick way, so that there would be a quick turnaround, so that the risks of not taking the medication that's prescribed to you will be easier to navigate through quicker, so that you can get to what you need. We are hoping to have this introduced in the House of Representatives soon, and maybe by this event in late March it will be. But if it's not, we really urge all of the watchers out there, when you call your congressional offices, that one, you ask your senators to support S-464, which was introduced by Senator Lisa Murkowski of Alaska. And if it's a House of Representatives congressional member that you're speaking to, that you ask them to consider helping to introduce the act, or please sign on to it when it is introduced. And we are confident that this bill will be introduced during this congressional session. And we really hope that this is the congressional session, this is the year that we'll be able to get this bill passed. We also have a couple other issues that patients face in the area of patient access, and one of those is in regards to like medical foods and dietary treatments. What we find here at IFFGD is so many people really and truly want to know more about how food and diet can affect their lives, and how they might be able to figure out how food is contributing to the severity of their symptoms. And many people know, you know your bodies, you know that if you eat certain things, it causes a flare or an episode in your body, and you want to be able to learn more about that. And you want to be able to go to a dietitian and work with them, like you, as part of your healthcare team. And there is some legislation that is we are working on, and there is that helps to urge Congress to allow for reimbursement to dietitian. This is called the Medical Nutrition Therapy Act. And this act, once it's introduced and passed, will require that dietitians be a part of that healthcare team that is reimbursable by insurance companies. Therefore, you don't have to pay out of pocket for the services. And there are many, many dietitians that specialize in GI disorders. IFFGD is very proud to have a listing on our website, our dietitian listing, of dietitians around the world who are committed to working with patients with GI illness. And these trained professionals know about many, many different GI diseases, what are the best nutrition therapy for them, and can help to tailor a diet for each individual person as an individual. And this act will really help to allow patients access to that type of treatment in a way they didn't have before, because financially it's very expensive to keep going to these different specialists.
Absolutely. Thank you so much for giving us such a detailed overview of the importance of these legislative priorities. And many patients and caregivers and anyone watching this can likely relate to one or more of those patient access to treatments priorities that we advocate for. And of course, as you said, please advocate to your senators about the Safe Step Act, S464, and to your House of Representatives about looking for that legislation that will hopefully be coming out soon in this Congress, so that we can get that legislation passed, as it has been gaining support over the years that it has been introduced, and we really hope to get some movement on that to really make a significant change for patients.
Absolutely.
And now that we've discussed our patient access to treatment priorities, can you tell us a little bit more about our legislative asks regarding education and awareness of GI conditions?
Absolutely. So education and awareness are really important to the GI population. One is there's so many people that just don't know enough about their disease states. The general public doesn't know enough, and there needs to be more awareness brought out about the sufferings and the things that we live with each day as patients with GI illness. And so IFFGD is actually advocating for a program at the CDC for chronic diseases education and awareness program. Now, the CDC is a governmental agency that focuses on surveillance, providing education, and public awareness. And this is in order to increase diagnoses and to improve patient outcomes, especially though for those with chronic GI illness. And so what we're asking for is $5 million for this program in 2022. This would allow the CDC to expand its portfolio of disease states that it covers. The CDC has a very deep portfolio of quite a few chronic diseases that it already has a lot of programs for, but it is lacking the funds to expand that portfolio. So while they would really love to add more chronic conditions to the areas that it raises awareness about and educates people about, they need funding to do that. And in order to do that, Congress needs to add that into the appropriations funding bill and package that they passed for 2022. We have joined with other organizations and are asking for $5 million for this program.
Thank you so much. It's great to know that the CDC has wonderful programs in order to help raise awareness and education, as you said, to even the general public, for people who may not be directly impacted by GI disorders, or maybe they are but don't know yet because they don't have the education to really be aware of their symptoms and the impact of them. Mm-hmm. And as we discussed through all of these legislative priorities, that there's many aspects relevant to the GI community. And one thing we especially touched on, as you discussed step therapy and medical nutrition, is that these priorities may change, that legislation may be introduced. So can IFFGD's legislative priorities change at all throughout the year in this 117th session of Congress?
Absolutely. Marissa, things are always changing, as we know, even in 2020, right? How no one anticipated that COVID would be upon us in March, in this time last year, and everything changed, right? So things are often happening very quickly. on the Hill, new legislation is being introduced. Maybe one bill gets passed, which then raises maybe an idea or a need for something else. And as needs come up and as things happen, as they do so quickly, IFFGD stays on top of all of the issues. And anytime we are informed about something that is affecting our community here at IFFGD, we take a long, hard look at it. And often mid-year, we'll add items to our legislative priorities, especially if a new bill is introduced that will directly affect our patient population. And so as this happens, we will try to keep everyone updated. We have a newsletter, which is the Advocacy Connection. And in this newsletter, we do inform people of what is going on in Congress. What's new and happening? Are there new bills being introduced? Are there new issues that need to be addressed? And oftentimes that does happen mid-year. And so while we have set our priorities for 2021, that doesn't mean that they're going to remain that way. Maybe mid-year we change our priorities, or we shift a little bit, or we add an additional priority. This is all just part of working in the field of advocacy, and we want to try to keep people at home informed of these as well. So please stay tuned with IFFGD to learn more about any new priorities that may come up.
Absolutely. Thank you so much. And as she said, the IFFGD Advocacy Connection is a way to stay on top of any changes in legislative priorities and issues and new news related to advocacy. So if you would like to join that newsletter, or if you have any other questions regarding the legislative priorities or advocacy at all, you can please email advocacy@iffgd.org, or you can also call us at 414-946-1799. And this can be with any questions regarding advocacy, any concerns, anything we can assist you with during your advocacy efforts, or if you have other questions as well. And thank you so much for Ceciel for taking the time to share with us this important information about IFFGD's 2021 legislative priorities and what they all mean and the significance of each aspect. And for those watching, you can watch more of IFFGD's virtual advocacy event program on our webpage. Thank you.
Thank you.